Power grids fail. Fiber optic cables get cut. Software updates introduce bugs. Eventually, the clinical screen you are looking at will freeze, and the electronic medical record will go dark. At M&T Healthcare, downtime is a routine operational event, managed through specific, rehearsed protocols rather than improvisation. When the system drops, clinical staff must switch to paper documentation, physically secure those records, isolate potential cyber threats, and reconcile the data once the network returns. The single prerequisite for this transition is knowing the exact physical location of your department's downtime toolkit binder. If the EMR stops responding, immediately test if the failure is local or external. Open a new browser tab and attempt to load a standard internet site. If other sites load, the issue likely resides with the EMR vendor. Do not wait to see if the system resolves itself. Even a brief delay in switching to paper can lead to missed medication doses or gaps in clinical observation. Notify your charge nurse or the clinical director immediately. They will alert IT and officially announce that the facility is initiating downtime procedures. Unplanned outages rely on these quick reflexes, but scheduled maintenance allows for preparation. During planned downtime, the evening shift prints the patient census and medication administration records in advance to ensure clinical continuity. Rapid diagnosis and clear communication prevent the first minutes of an outage from degrading into a delay in patient care. The downtime toolkit contains everything needed to run the facility offline: blank intake forms, paper MARs, procedural checklists, and emergency contact lists for IT and leadership. Every role adapts instantly. Nurses transition to paper medication records. Counselors use paper progress note templates, and admissions staff utilize physical intake packets to register new arrivals. If a client asks about the change, be transparent. Tell them the computer system is temporarily down, and that you are documenting their care on paper to ensure their treatment continues without interruption. The physical toolkit acts as the facility's operational failsafe, allowing the clinical workflow to proceed while the digital system is restored. Every paper entry must be audit-ready, including 4 elements: client identifier, date and time, your name and credentials, and the action taken. Security rules remain in effect offline. You are prohibited from using personal devices or unsecure texts to communicate patient information. Do not take photographs of paper records. This bypasses our privacy controls and places protected health information on an unmanaged device. Secure these paper charts as rigorously as the EMR. Keep documents in a locked file drawer or with an authorized staff member, and ensure they are never left visible in public areas. Analog records carry the same legal and medical weight as digital entries. Physical security and high data precision are mandatory. System outages can also result from a deliberate cybersecurity attack. Watch for suspicious screen pop-ups or a ransom note appearing on your workstation. If you suspect an attack, stop immediately. Remove your hands from the keyboard. Do not click any links, close the window, or restart the computer. Do not turn on other workstations to check the network. This can allow a virus or malware to spread across the facility's entire server. Use a desk phone, not email or internal chat, to alert IT and leadership of the breach. In a cyber event, total physical inaction at the terminal is the most effective way for a staff member to contain a facility-wide breach. Once IT provides the official all clear, staff should stagger their logins. Logging in all at once creates a traffic surge that can cause a secondary system crash. Every note written on paper during the outage must be manually entered into the EMR before the end of your current shift. All entries made during this period must be marked as a late entry from downtime. Nurses must cross-check the paper MAR against the EMR to confirm every medication dose is accurately accounted for. After verifying that the digital record is complete, the paper originals are filed or securely shredded according to our record retention policy. The protocol is complete only when the physical documentation is perfectly mirrored within the digital system. Maintaining control requires following the full timeline: immediate alarm, physical transition, secure documentation, threat isolation, and final reconciliation. At M&T Healthcare, an EMR outage is an anticipated scenario we have equipped ourselves to manage. Ultimately, mastering these analog protocols keeps patient safety secure and clinical documentation continuous, even when the technology fails.